Hello student, in this video lecture we are going to discuss about the anti-manic drugs, which are very important topic as per your exam purpose of view. These drugs are helpful to control the elevated mood. These drugs may use into the bipolar mood disorder, mania and depressive psychosis. Here we have discussed the classification. Mainly the lithium drugs are called the antimanic drugs, lithium and lithium derivatives. Antimanic agents such as lithium bicarbonate, lithium citrate. These drugs mainly considered the antimanic drugs. In the antimanic drugs, we are also discussing some other drugs such as anticonvulsant drugs, for example, sodium vaporate, and atypical type depressant drugs such as risperidone. These are the classification of antimanic drugs. Next, we are discussing what are the indication to taking the antimanic drugs or lithium. Lithium drug may be can taken in the manic condition, bipolar mood disorder, manic depressive psychosis. What are the drugs do in our body? What are the mechanism of action of these drugs? Mainly these drugs helps to increase serotonin reuptake. That's why if the reuptake is increased, जब reuptake बढ़ेगा तो serotonin का लेवल क्या होता है, कम होता है. दैट मे कॉज द नॉर्मल मूड. जो आपका मूड इलेवेट हो गया उसको नॉर्मल करने का एक सेकेंडरी एक्शन है इसका. when we are taking the history of taking the medical laboratory examination of the manic patient, we can see that glutamate is a neurotransmitter which is extremely increased in the manic patient. Lithium actually stimulate the NMDA receptor. NMDA receptor, that means N-methyl deaspirate receptors, which is a receptor that binds the glutamate. ठीक है. सो ग्लूकामेट अगर एन एम डी एस रिसेप्टार से बाइंड हो जाएगा तो उसकी अवेबिलिटी कम हो जाएगी. ठीक है. सो दिस इज द मेन mechanism of action of this drug that decrease the serotonin level, also decrease the glutamate. What are the side effects of these drugs? These drugs may cause polyuria, thirst, diarrhea, convulsion, coma, hypothyroidism, hyperthyroidism, hyperglycemia. These are the side effect of these antimanic drugs. What are the pharmacokinetics? Means what does our body do with the drug? These drugs well absorbed orally, metabolized in the liver. These can cross the placental barrier, excreted through sweat, saliva, urine or breast milk. That is the pharmacokinetics of these drugs. These drugs can be contraindicated in the diabetes mellitus, severe dehydration, cardiovascular disorder, hypersensitivity, प्रेगनेंसी एंड लैक्टेशन एंड थायराइड डिसऑर्डर. इन सब में ये ड्रग नहीं दी जानी चाहिए. दीज ड्रग्स कैन इंटरेक्ट मीन्स रिएक्शन कर सकती हैं विद द डायरेटिक्स. डायरेटिक्स के साथ लिथियम नहीं लेना चाहिए क्योंकि इन दोनों ड्रग्स को दीज combination of these drugs can cause toxicity. लिथियम ड्रग्स एंटी साइकोटिक ड्रग्स के साथ नहीं देते, जैसे टेट्रासाइक्लिन जैसे होलपेरिडोल नहीं देनी चाहिए क्योंकि ये दोनों मिलके एनसेफेलोपैथी कर सकती हैं. These drugs not to be used with sodium bicarbonate because sodium bicarbonate can वो अब्जॉर्प्शन को बढ़ा देता है, इसके लिथियम के रिटेंशन को इंक्रीज करता है इन द लिथियम थेरेपी. सो we cannot use the high sodium diet in the lithium therapy when we are using the antimanic drugs. These drugs never be used with caffeine Uh, the caffeine may decrease the lithium effectiveness. These drugs can be used with the benzodiazepines. Okay, these are the drug interaction. You must take the nursing responsibility when you are taking the lithium therapy. It is very important part. Assess the therapeutic blood level. The therapeutic blood level of lithium is 0.5 to 1.5. It is the known as the therapeutic index. So during the lithium therapy you must be evaluate the uh, therapeutic blood level of lithium, because it may cause the severe toxicity if it is high more than the 1.5 milliequivalent per liter. Assess the suicidal tendency in patient. Guide the patient about the side effect of bicarbonate effect like diarrhea, drowsiness, convulsion that may related with the increased therapeutic blood level of lithium. Administration drug with food. Educate the patient regarding the daily drink 2 to 3 liters of fluid. Maintain adequate salt intake. Avoid excessive amount of coffee, tea. Avoid drinking. Avoid driving and the hazardous activity. These are the nursing responsibility. You may educate the patient regarding these. Thank you, student. If you have any doubt, you can ask me anytime.